Hello, listeners. Welcome to Views on Health. A great pleasure to have with us on the program tonight Dr. Duleepa Baranage, consultant eye surgeon at the National Hospital in Kandy. Welcome back to Colombo and SLBC.
Thank you, Fatima. Thanks for having me in.
And Dr. Duleepa Baranage is going to focus on a topic called flashes and floaters. Well, to us lay people, it doesn't sound as a medical problem, but definitely it is related to the eye or the eyes and the problems that come about because of flashes and floaters. Over to you, doctor, to explain what flashes and floaters are.
Yeah, thank you. Thanks, Fatima. Right. So, as the name denotes itself, flashes are just flashing lights. You see a light flashing in front of your eyes, and then floaters are particles, dark particles mainly, which floats around wherever you move your eyes. The floating particles will also move. Well, it's not an uncommon problem, right? Everybody at some stage of their lives will actually experience flashes and floaters. Why? Because the main reason for them is actually age related, right? As many other eye problems. So when you grow older, there are some physiological changes which happens in the eye, which leads to these flashing lights and floaters. So if I may elaborate more, now your eye has several components. The back of the eye or the inside of the eye is actually composed of a gel form called vitreous. So this vitreous is in a gel form when you're younger, and when you grow older, because of this chemical reactions inside the eye, this vitreous contracts and starts to dissipate or break down, and then it forms a more liquid form. So when it breaks down on this vitreous gel is slightly or not tightly, but slightly attached to the retina. Retina is where your nerves are, and all the impulses, your light impulses, are grasped by the retinal fibers, and then the retina forms an optic nerve, and this optic nerve only goes to the brain to form your image. So retina is probably the most important part of the eye, because there is where your sensitive elements are. So this the vitreous, the gel I was talking about, is slightly attached to the retina. Now, when this gel form goes away, this tries to pull off the retina. We call it a posterior vitreous detachment. The vitreous tends to detach from the retina. So when it starts to detach, only you see a flashing light, right? Because of the impulse it causes on the retina. And then once this detaches, you might see a floater, that gel, half-formed gel particles floating around, and you see a floater. So everybody undergoes this change. It typically starts at around 40, right, and ends at around 60. So it's a very innocuous thing which happens in the eye, which is normal to many. But there are problems. There in some eyes it can be a problem. So that's why whenever you have flashes and floaters, we ask you to see a eye surgeon immediately, because of other problems which can give the same symptoms.
Thank you, doctor. Now, does one see these flashes and floaters at any time of the day, or particularly at night, perhaps?
Yeah,
Could you
well,
explain?
at any time of the day, when they get flashes, on the trot, and there's no particular time. Well, there are a subset of flashes which can be again a normal variant, which happens early in the morning when you wake up. But then, generally the flashes I was talking about happens, haphazardly. There's no particular time of the day. But probably, it's like, even if you close your eyes, you can actually see those flashing lights. And floaters, of course, hover around, and they are much more noticeable on a white background. If you look at the sky, or at a white background, these because the particles are mostly black, because of the shadowing effect, and just you see them more prominently on a white background. But flashes, of course, you see it Yeah, at any time of the day.
So now you said from the age of about 40, this can happen. Now, is this related to wearing spectacles or not wearing spectacles?
Yeah.
If supposing a person is wearing spectacles or a person who is not wearing,
Yeah.
will both have this experience of flashes and floaters?
Everybody will have flashes and floaters at any time of their life. So we'll talk about why it's dangerous first, and then I'll explain you why it is very important in those particular subset of people. Right. So I told you now the vitreous detaches from the retina, which can cause a flash, and then when the vitreous detaches from the retina, you see a floater. Now in some eyes, the vitreous can be tightly attached to the retina, right? But still the vitreous will never let go. It will somehow try to pull off the retina. Then also you will see a flashing light, of course, more prominent flashing light maybe. And when the vitreous pulls off, it causes a tear in the retina. It takes a part of the retina with it as well. Now you have a retinal hole or a retinal tear. Now this particle also you will see as a floater. Now it's a problem. Now there's a tear in the retina, and I told you now once the vitreous gets detached, it's more liquid form. This liquid can seep through that tear, and your whole retina can strip off your eye. So that's called a retinal detachment. So that you will feel as if a curtain is pulling down or a curtain is pulling up. Your whole visual field can go black from one side to another. So then, of course, it warrants a urgent surgery. That's where my specialty comes up. As you mentioned, I'm a consultant eye surgeon, and I'm a consultant eye surgeon specialized in vitreoretinal diseases. I'm a vitreoretinal surgeon, so that's where I come into play. Only a few are there in the country. So then we have to go in quickly and do a surgery to rectify that. So before that, right, if we see a tear alone without the retina being detached, right, if we just see a tear, what we do is we do laser around the tear so that we prevent that fluid going beyond that laser marks and then preventing a whole retina being detached and the whole surgery. So that's why it's important to get yourself checked if you have flashes and floaters, which can be innocuous in most of the time. It can be harmless, but in these there can be a tear which might be missed, and then you will end up having retinal detachment, and then we have to go in for a big surgery to make it right again. So if you have flashes and floaters, yes, you have to see a doctor to get that certificate. You have to see an eye surgeon to get that certificate saying that, okay, it's a normal age phenomenon, don't worry, you will have these floaters forever. I mean, the floaters also will never go away, right? It will be there forever. And it can, you can get accustomed to it after some time, and then of course when you get used to it, you kind of try to you will ignore it more. But if you really focus, you might see these floaters. But again, it's better to get it checked before getting a retinal detachment.
Why I asked you about a person whose
Yes.
eyes, a person who may
Spectacles.
wear spectacles or not, because from our perspective, if a person is not wearing spectacles of any form, I mean, no lens, I mean, not even contact lens or anything,
Yes.
that means we think, oh, that person's sight is pretty good. And the person who wears spectacles, obviously their eye may be a bit weak, and therefore, he or she is wearing spectacles. So from that point of view, doctor, just wondering whether a person whose eyes are not that weak, who doesn't wear spectacles, will also have this same sort of experience. But you said, yes, everybody goes through it.
Yes. Yeah, very good question. Yeah, so I missed that part actually, your initial question. So coming into that, now I said the normal aging phenomenon happens in everyone. So there are specific eyes which are prone to get this whole, even the vitreous detachment, even a retinal detachment, more than the normal population. Now these, for an example, if I quote one or two, yes, spectacle users, those who are nearsighted. So those who wear spectacles or they have a spectacle error, it's not about the wearing the spectacle or not. You have a spectacle error since you are a kid, right? These people will have this aging phenomenon happening a bit early, not in their 40s, maybe in their 30s or maybe late 20s, right? And then also the vitreous is tightly attached to the retina in more places than in a normal person. So they have the potential of getting flashes and floaters earlier, and also they have a very high chance of getting retinal detachments, right, rather than in the normal population. So the retina, they can have retinal tears. Floaters, flashes, more often than not, will actually present with a retinal tear. If you don't do laser quickly, they will actually end up having retinal detachment. So the other causes would be if you have a trauma to the eye. This whole thing process happens earlier. So what is supposed to happen at 40 will happen at 30 or 20. And then again the risk of retinal because by the time you're in your 30s, the vitreous is anyway attached a bit firmly to the retina. So if you induce the whole thing a bit earlier, there's a chance that the retina can detach, or the retina can tear off and later lead into a detachment. Trauma, any kind of trauma, you do a surgery to the eye, that's also kind of a trauma. So you do early surgeries to the eye, there's a chance that your retina can detach much earlier. If you inject something into the eye, right, there are specific diseases we inject drugs into the eye, there's a chance that not that it will happen, but the chances are a bit higher than in the normal population. Myopes will have that. So yes, to answer your question, yes, it's not using or not, it's not about using spectacles. Those who have spectacle errors are prone to have flashes and floaters, and again those flashes and floaters can be the dangerous kind of flashes and floaters compared to a normal person.
Very interesting. Just another question, doctor. Now, the eyes, like every part of our body, needs rest. When we sleep, the whole body is at rest, including our eyes. During the day, as much as like exercising is advocated, it's important to be fit, healthy. Taking your eyes, there are people who are avid readers. They cannot put a book down. They love reading. Then there are the computer users all the time. Maybe it's a job. Sometimes it's an addiction because they're playing games and other things.
Yep.
Same thing with the mobile phone. And then there is the TV. Maybe that's the least of, in my opinion, I may be wrong, please correct me, of the issues. Because in TV, you're anyway from a distance away. Watching TV, but you don't maybe not watch as much as you would still be on your phone or computer or read. In such situations, the eye is taxed.
Yes.
The using the eye so much.
Yes.
Please comment.
Yes. So now, so if you really see all the most educated people during your whole history, most of them do wear specs. Now there's a reason for that. Now, as you said, avid readers, right? So the more you do close-up work, this happens actually during the childhood, right? Not after maybe 18, right? But during the childhood, the more you use your eyes for close-up work, you will actually end up being a myope. Now that's a proven thing. Myope is, you're short-sighted. Long distance is not. So it's important to use your vision for both long and short distances, especially when you're a kid. So that's why outdoor playing and all is all advocated while reading. So most of these avid readers are actually spectacle wearers because they can't see far clearly. It's blurred, and you're short-sighted. You end up being short-sighted. Now the trend is much more because of the computer or screen usage. It's another separate topic to be covered. So because of all these screens, now of course kids are more prone to let go of all the outdoor activity, and they are mostly indoors and they're on the phones. So this short-sightedness is worsened. So as I told you, now this aging phenomenon happens much earlier in short-sightedness, those who have spectacle errors, right? And then of course they have the tendency to get their retina detached much earlier, or the tendency is anyway higher than in the normal population, simply because you're short. Because the more you use your eyes for near, the physiology of the eye actually changes. Your eye lengthens. The eye can, because when you're growing up, everything kind of accommodates to to your needs, right? So that is normal in any organ. So when the brain thinks you are doing more near work, the brain tries to gear your eye to do more near work. So then the physiology or the architecture of your eye changes, and that can lead to your short-sightedness. And again, all these problems are exaggerated. So yes, so spectacle errors do actually need kind of lead to those kind of errors. And yeah, it's a unavoidable thing right now. We can't say no to screens or no to reading, but you have to balance yourself out. You have to have some outdoor activities as well.
End of the day, doctor, there are so many people who have issues with their eyes. What would you advise them to do? I mean, yes, definitely, you just spoke of balancing, right? But sometimes they just can't balance because there's a need. I'm not talking about those who are addicted. Then you're bringing it upon yourself by actually going into something over and beyond your limit.
Yes.
But sometimes, unfortunately, it's the nature of the job, and nothing can be done about it.
Yes. Now, as I said, this short-sightedness actually develops and happens during your childhood. So the biggest development happens in your first 12 years of life, and then it maintains until 18. And after 18, there's hardly whatever even if you use your eyes to read or do more screen time and all, will not actually affect your refractive error that much after 18. So this is actually involved in the childhood. So for children, yes, it's important to stress on the fact that yes, you have to read. Reading makes you perfect, yes, but still while doing near work, you have to balance it out with the distance work as well. When it comes to a job, after 18 and all, yes, then it's a different story. There's this new entity, not new, but post-COVID, it has come up a lot. We call it digital eye strain. In lay terms, it's computer vision syndrome. So there are proper ways of using computers. It's a whole another episode. We'll do one on that as well. So it's a computer vision syndrome, how to cope up with it and how to do it stress-free to the eyes. How to do your day-to-day life activities and job on a stress, how to do it stress-free. But the thing I was talking about, the flashes and floaters and the retinal detachment, all these risks happen purely because of your if it happens purely because of your short-sightedness. To prevent short-sightedness, it's a whole other phenomenon which has to be addressed when you are a kid, just particularly before the age of 12.
So, end of the day, this can be treated.
Short-sightedness, to some extent, yes. Retinal detachment, since our topic is all about flashes and floaters and retinal detachments, flashes and floaters, as I told again, it happens to everyone. If it goes into a retinal detachment, if it happens to be a retinal detachment, yes, retinal. That's where I come in. I told you I'm that kind of a specialist. So if your retina detaches, yes, there's a surgery to be done. The earlier you do the surgery, the best results are. The outcome is very much better. You can even get your vision back to what it was. But the more delay you take, if the surgery is delayed, of course the outcome, yes, will be better than before. But it might not be as the best outcome possible. So as I told you, if you have flashes and floaters, better to see a doctor. And if you see this curtain pulling down or curtain pulling up, that means your retina is detached, better to see an eye surgeon as soon as possible. And if the surgery is warranted, we do the surgery as soon as possible to get the vision back. Yes, everything is treatable. The thing I have to stress is, you have to go show your eye surgeon as soon as possible. And that's the delay we see in Sri Lanka. The delay in getting the patient to see you, or the patients kind of stay at home saying, okay, this can be normal, this can be not normal, and they come up a bit late, which can affect the final outcome.
So, doctor, once you treat it, and then you said that it can come to near normal, can there be a reversal?
Yes, it can. There can be. Now that's the thing. The later you operate, or the later the presentation, The retina, once it is off the eyeball, right, the retina, once the retina is detached, there are another changes which happens in the retina, so which can lead to the surgical difficulty as well, right? And so then we'll have to put something into the eye, mainly it's gas or oil. So in chronic detachment, so that is long-standing detachments, we put oil in the eye, and we have to go in again to remove the oil. Yes, so as I said, if the retinal detachment is long standing, that the surgery itself is also a bit tough to do, and then there's a high chance of redetachments as well. We might not end up with just 1-2 surgeries. It might they might end up having 2 or 3-4 surgeries to attach retina, and the more you go into the eye, the more damage you do, and inevitably they will lose some of the fibers they already have. So our final outcome will not be as expected, as what it was before.
So it can happen to anyone at any age.
Yes, at anyone at any age, and some have the potential of developing it much more and much earlier than the rest of the population. Those like trauma, nearsightedness, and some other diseases.
Do any of the NCDs play a role in this?
Sorry?
Any of the NCDs play a role? Diabetes, high blood pressure?
Really. Diabetes per se. Well, now if we talk about retinal detachments, now I was talking about these rhegmatogenous retinal detachments, that is retinal detachments caused by retinal tears, right? These are preceded with flashes and floaters. Diabetics do get retinal detachment, another subset of retinal detachment. We call it fractional retinal detachment because of the changes inside the eye. I told you, I think I spoke about it a few weeks back. There are changes which happens with new blood vessels coming out, and these new blood vessels can pull on the retina and cause a retinal detachment without causing a tear. It can cause a tear as well. Then we call it a combined retinal detachment, combined fractional plus rhegmatogenous retinal detachment. So yes, so those also warrant urgent surgeries. So those surgeries are also done by with retinal specialists like of me. And then yes, so diabetes do have a tendency of having retinal detachments, but another subset of retinal detachments. Then other diseases, not so much, right? Hypertension and all. Well, yes, in rare occasions they do have other causes which cause retinal detachment, but rhegmatogenous retinal detachments are another separate entity which happens on its own. So if you take NCDs for that matter, diabetics, yes, they will have tractional retinal detachment. Is another subset, another very those are very hard cases to sometimes tackle. So early surgery is anyway better. So if you have any problems with the eye, it's better to show your eye surgeon as early as possible. Early intervention will actually make your life and the surgeon's life both easier.
Thank you, Dr. Time has caught up with us. It's been interesting listening to flashes and floaters. Would you, before we wind up, reiterate what to look for?
Yes, so as the name suggests, you
Flashes
have to look
floaters.
for flashes and floaters. Flashes just coming out of nowhere. You can see a flickering of light out of nowhere, from down to up to down or down to up or whatever, right? And then floating particles. Well, everybody will have some kind of floaters, but you will suddenly see a new floating particle or a few particles for that matter. Yes, better get it checked as soon as possible. And if there's nothing wrong, we will of course advise the patient what to do from there onwards. If there's something wrong, there are things to be done in the early stage to prevent more dangerous things happening in the eye. And if it has gone to a certain stage where the retina is detached, again there are things to do to get back your vision to what it was. So yes.
So there is hope.
There is always hope.
Thank you. And on that hopeful note, we end this interesting discussion on flashes and floaters. To you, Dr. Duleepa Baranage, consultant eye surgeon at the National Hospital in Kandy. Thank you very much for being with us on the program and sharing your valuable knowledge and expertise on this particular topic. Thank you, Doctor.
Thank you. Thanks a lot.
Thank you too to Prabha Veerasurya for technical assistance. I'm Fatima Razikada saying good night and hoping to catch you next Monday, same time on Views on Health.